we're going to learn about Guillain-Barre Syndrome. And to do that, we're going to watch a video about Ned the Nerve.
This is Ned the Nerve. He might look a little funny, but he has a very important job to do in your body by helping your muscles move when you want them to. But sometimes your muscles don't move when you want because of a nerve injury or disease. One disease that can do that is Guillain-Barre Syndrome. We just call it GBS for short. Maybe someone you know has been diagnosed with GBS, or maybe even yourself. If so, you probably want to know more about GBS and how it involves nerves like Ned. First, more about Ned's job. Nerve cells, or neurons, send and receive messages to and from your body using electrochemical impulses. The nerve cells involved in your peripheral nervous system, which controls the ability to feel and move, have extensions called axons that can be several feet long and are covered in a fatty coating called myelin. You can think of myelin like the insulation around an electric wire. It helps to speed transmission of messages along the nerves and make sure that the messages get to the right place at the right time. But with GBS, the myelin coating around the nerves is damaged and removed, which stops the nerves from delivering their messages properly. The first signs of GBS are often a weakness or tingling in your legs. Think about it. The nerves in your foot extend all the way up to your brain. There's a lot of places for a message to get lost. As GBS progresses, numbness and weakness usually spreads up your body, and in some serious cases, it can affect your breathing and facial muscles as well. Doctors will have to run a few tests to confirm if you have GBS, including a lumbar puncture and an EMG. Plasmapheresis and IVIG are often helpful to shorten the course of GBS and limit nerve damage. The acute phase of GBS typically varies in length from 4 to 6 weeks, with over 90% of patients moving into the rehabilitative phase within 4 weeks. You might be wondering how you got GBS in the first place. The truth is, doctors aren't 100% sure what causes GBS. But we do know that 60 to 80% of cases are preceded by some sort of bacterial or viral infection like the flu or food poisoning. Because of how GBS works, it isn't hereditary or contagious, so you don't need to worry about passing it on to your friends and family. Also, GBS has a very low mortality rate, and 95% of patients recover to varying degrees from it. The chances of getting GBS again are the same as getting GBS in the first place, about 1 in 100,000. Recovery from GBS may take 6 months to 2 years or even longer, and many patients continue to have long-term recurrences of fatigue and/or exhaustion, as well as pain, numbness, and muscle aches.
You guys were all so diligently watching the video, I'm going to give you all a verbal.
Don't you mean oral?
Verbal pop quiz. Jessica Armstrong, what is GBS?
Guillain-Barre Syndrome?
No!
Guillain-Barre Syndrome.
Guillain-Barre Syndrome is an inflammatory disease in which demyelinization occurs in the axons within the peripheral nerves. An autoimmune disorder essentially means that the immune system is attacking itself. This may sound a lot like multiple sclerosis, but it is not. In multiple sclerosis, demyelinization occurs in the axons within the central nervous system. GBS, on the other hand, affects the peripheral nervous system.
What is the cause of GBS?
The exact cause of GBS is rarely found, but it is believed to be a reaction from prior infections. GBS usually occurs after respiratory or gastrointestinal infection. This syndrome may also occur with viral infections such as AIDS, herpes simplex virus, or mononucleosis, often called the kissing disease. This disease can occur at any age, but it is most common in men and women between the ages of 30 to 50 years old.
What is the outlook for patients with GBS?
Most patients that are diagnosed with Guillain-Barre syndrome make a good recovery within a year. 80% of patients are up and walking again within 6 months of the onset of symptoms. The ongoing impact of GBS can be significant in some cases though. About 50% of patients have minor lasting neurological issues, 15% of patients have remaining damage in daily functioning, and 5% may die of secondary systematic organ failure. Overall, survivors of GBS will continue to improve 2 years after their injury.
Samantha Shepard,
What?
what are the symptoms of GBS?
Some of the main symptoms of Guillain
No!
Guillain-Barre Syndrome.
include motor and sensory loss that affects the face, limbs, trunk, and diaphragm. There is some damage to the reflex arcs of the deep tendon reflex, causing areflexia, which is absence of neurological reflexes. There is also the presence of inflammatory cells, lymphocytes, and macrophages within the peripheral nerve. Symptoms of GBS can often come on rather quickly, some severe symptoms coming on within just a few hours. Muscle weakness and loss of muscle function affects both sides of the body, but is ascending paralysis, meaning that it starts in the legs and spreads to the arms. The inflammation of the disease also affects the nerves in the chest and diaphragm, making it difficult to breathe. Typical signs and symptoms include loss of tendon reflexes in the arms and legs, tingling or numbness, muscle tenderness or pain, which is a cramp-like pain, uncoordinated movement, low blood pressure or poor blood pressure control, abnormal heart rate. Other symptoms include blurred or double vision, clumsiness and falling, difficulty moving face muscles, muscle contractions, and feeling the heart beat through palpitations. Emergency symptoms include breathing temporarily stops, cannot take a deep breath, difficulty breathing or swallowing, drooling, fainting, or feeling lightheaded when standing.
How do you treat GBS?
Treatment for this disease is more directed toward the immunological aspect. Gamma globulin administration and plasma exchange are the most popular treatments as of right now. The gamma globulin blocks receptors where antibodies attach to cause damage. With plasma exchange, blood is removed, plasma is filtered out and replaced with albumin so the antibodies causing demyelination are eliminated. Other treatments include blood thinners to prevent blood clots, breathing support through a tube or ventilator if the diaphragm is weak, pain medicines to treat pain, proper body positioning or feeding tube to prevent choking during feeding if the muscles used for swallowing are weak, and physical therapy to help keep joints and muscles healthy.
Alicia Fassinger,
Yeah.
what are the central or peripheral nervous system structures and what is wrong with them?
Well, in Guillain-Barre Syndrome.
No!
Okay.
Guillain-Barre Syndrome.
Fine. Guillain-Barre Syndrome is a rare disease which causes the immune system to affect the peripheral nervous system. GBS is a rapidly evolving motor paralysis with or without sensory disturbances. The usual pattern is an ascending paralysis that may be first noticed as rubbery legs. Weaknesses typically evolve over hours or even a few days, which is frequently accompanied by tingling dysesthesia or an abnormal sensation in the extremities. The legs are usually more affected than the arms, and facial weakness is present in 50% of affected individuals. In GBS, the immune system inflames the demyelinated parts of the nerves in the periphery. It is theorized that the immune system has the inflammatory response because of elevated levels of interleukin-17 and interleukin-22, which are pro-inflammatory cytokines produced by helper T cells. Higher levels of IL-17 and IL-22 within the cerebral spinal fluid correlates to GBS disability score scales. Also, the higher levels of these cytokines within the plasma has a positive correlation to levels of GBS as well. Elevated levels within the CSF can be explained by the disruption of the blood-brain barrier and peripheral nervous system local inflammation. The explanation of higher cytokine levels in plasma incorporates the idea of activation of Th17 and Th22 cells in the systemic immune response of GBS. The elevation of these cytokines in either the CFS or plasma can serve as a biomarker for the syndrome. Also, when diagnosing the disease, total protein concentration within the CSF is taken into consideration.
Is this motor control?
It is, and you're about 20 minutes late. Who are you?
They call me Sam, the man.
Well, Sam the man, what do you know about GBS? Have a seat.
Alright.
Sam the man,
What's up?
what are some other brain or body structures involved with GBS?
Well, the GBS causes damage to multiple nerve roots, causing neurological symptoms like pain, weakness, and sensory loss. GBS also results in axonal degeneration and/or demyelination in parts of the peripheral nerves. This can occur in both the sensory and motor spinal roots. In some rare cases, it can occur in the cranial nerves. Since the myelin sheaths are damaged, the ability to transmit signals is significantly reduced. So, there's muscles involved in this, and as stated before, muscles become weak when a person has GBS. The lower limbs are usually involved before the upper limbs in terms of muscle weakness. Proximal muscles may also be involved earlier than distal ones. Trunk and respiratory muscles can be affected as well. Cranial nerve involvement is observed in 45 to 75% of patients with GBS. Common complaints from these patients include facial droop, double vision, impaired or slurred speech, difficulty swallowing, paralysis of the muscles of the eye or surrounding the eye, and pupillary disturbances. Facial droop and eye paralysis usually appear after the trunk and the limbs are affected. So 70% of GBS patients acquire an autonomic dysfunction, and these changes include tachycardia, fast heart rate, bradycardia, slow heart rate, facial flushing, hypertension, orthostatic hypotension, and inability to sweat normally.
Bailey Ford, my favorite student. Give me an interesting fact and tell me something important about GBS.
An interesting fact about Guillain-Barre Syndrome.
No!
Guillain-Barre Syndrome.
Over the years, there has been a strong link between the H1N1 vaccine and GBS. The first documentation of this was seen in 1976 amidst a swine flu outbreak. The outbreak is most remembered for the mass immunization that is prompted in the United States. However, side effects from the vaccine are thought to have caused 500 cases of GBS and 25 deaths. This is important because GBS is a side effect of the H1N1 vaccine. In 1986, a law was placed for people to report side effects of vaccines to the Vaccine Adverse Event Reporting System. This system is voluntary though, and there are no consequences for not reporting. The president of the National Vaccine Information Center stated in the article that only 1 to 10% of adverse effects are reported. This limits the understanding of how many cases of adverse effects there have been to the H1N1 vaccines and other vaccines. This raises the importance because if medical professionals do not hear about the side effects, then knowledge cannot be gained to improve the vaccines and prevent side effects such as GBS.
Wait, where are we going? I'm not done yet.
So when will we know our grades?
Bailey, you got an A. Just leave.
What?
If you can hear me, clap 3 times!
Why are we doing a clapping thing?
In the early stages,
Such
a big word.
In an article written by Jonelle Alicia from
MSNBC.com?
Yes.
Samantha Armstrong.
now.
The GBS causes damage to multiple nerve roots, causing neurological symptoms like pain, facial droop, double vision,